So as you all know by now, you know what is diabetes. So I believe education is an important and integral part of diabetes. So I'll be looking into the lifestyle medicine to prevent and control diabetes. So I'll just turn off my camera and then I can just proceed with the presentation. Yeah. Okay. So um, lifestyle medicine. So what is it? It's an evidence-based practice of helping people to adopt a good nutrition with better physical activity, to relieve their stress, to have a proper sleeping pattern. This all is involved in lifestyle medicine. One of which is good nutrition. It's a cornerstone of good health. You need to have always a balanced diet with regular physical activity. So, in order to take charge of your diabetes, these are the cornerstones: the diet, exercise, medication, and regular follow up, as Dr. Asia has advised. Fahad, the second slide, please. Okay, and regular exercise is also an integral part of the daily routine of a diabetic patient, which I'm gonna explain in detail in the forthcoming slides. So, why should we be concerned about nutrition? Because it's the first step in a diabetes treatment plan, and the therapy is aimed to change the eating pattern and in the lifestyle of people. Why do we have to be so concerned about nutrition, especially in 2020? Because we all, I believe that most of us are leading a sedentary lifestyle with unhealthy eating habits, which thereby leads to high blood sugar, high blood pressure, high blood cholesterol. Hereditary and aging is a supporting factor for the, along with sedentary lifestyle and unhealthy eating habits. So it's all connected, leading towards obesity as well. Next, please. So why should we change the eating habits? So that's a big question. So if we are putting at least 50% of change in your eating habits, you can definitely control your blood glucose, the cholesterol, the blood pressure, you can reduce your weight, and by doing all these things, you will be able to prevent the complications of diabetes or delay the complications of diabetes. And secondly, by making healthy food choices and being physically active, at least a small percentage of physical activity, if it is done, definitely you will be able to improve your overall health and well-being. Next. So one of the step for that, the initial step is to find out how many calories you need for a day. It is a first step in managing your weight and thereby controlling the diabetes. So how do you find your calories? You need to, each person has a individual calorie intake. So that you need to assess that, you need to get back to your BMI, know your BMI, and then as per that the calories will be calculated and accordingly you need to take them. But if you're physically active also, you can in fact balance your calories. But the point is, if you're overweight, you need to watch your portion sizes and lose little bit of extra weight that you've gained in order to get a good control over diabetes. Next. Another, the main key point in diet and diabetes or a lifestyle change is having a balanced diet. Make sure all your meals, the breakfast, the lunch, the dinner, whatever you have, it has to be a balanced one which has all kinds of nutrients in it in the right proportion, meeting your daily calorie intake. It has to be from all the nutrients like the carbohydrates, the proteins, the fats, and the micronutrients, vitamins, minerals, including the water as well. Next. So being a diabetic, even in fact, even if you are a pre-diabetic, I think you can set a goal, a nutrition goal for yourself by the first thing should be in your goal list is to have your three major meals. Try not to skip your meals, even if, and breakfast is a major meal of the day. Try not to skip your breakfast and try to keep the three meals regular on time, including healthy snacks in between. We advise 2 to 3 healthy snacks. At least minimum of one snack a day will bring a big difference. And then one serving of carbohydrate. Whenever you're just look into your plate, whenever you're served, whenever you're serving yourself carbohydrates, make sure that you have some proteins in your plate and lots of vegetables in your major meals, be it your breakfast, lunch, or dinner. Make sure there's no more than 45 grams of carbohydrates at one time, and try to limit and try to avoid processed foods. Try to go for whole foods, the complex carbohydrates foods, which I will be explaining in the next slide. So, and try to avoid juices, regular sodas, canned juices, even if it is fresh. Limit sweets. Also, you need to be try to keep a goal of avoiding the fatty fried foods, and maybe keep it as a treat once in a while. And definitely you need to consult a medical nutrition therapist for customizing a plan for you. Next. So once you set your goal, you know what is balanced diet, you know what has to be done. Another very, very important topic, or maybe a very important thing that we all ignore, or we don't look into, is the label reading. Whenever you are in a supermarket, in a shop, in a grocery, we just grab the list of food that we need, and then we fill our trolley and we take it home. But then try from next time, try reading the nutrition facts, just a glimpse of that, before putting the product into your shopping cart. I believe you can just have a small scan over the nutrition facts, where you will be able to identify if the product is good for you, better or bad. So sometimes it's a little complicated in reading this, but I can give you few tips to read it out. Remember, whatever values that has been mentioned on the product is not for the entire product. It is only for one serving. So how much is one serving? For that particular product, the one serving, or how much ever the serving sizes, will be mentioned on the top corner. So you will have an idea of one serving size. Example, if you have a box of 10 cookies, the whatever nutrition value is mentioned on that cookies is not for the entire box. They might be having a serving size of, maybe the serving size is 2 cookies. So all those information is only for 2 cookies. So if you're having 4 cookies, then definitely you need to multiply and keep adding the calories and the rest of the nutrients in there. So the first thing that you need to do is look into the serving size. Second thing that you need to do is to remember a rule of 5 and 20%. So all the good nutrients, I think you can see the slide, all the good nutrients like the vitamins, the calcium, the iron, proteins, these are all, if it is about 20%, it is really good. And you need to get enough of these nutrients. But then try to choose a product which is less in saturated fat, cholesterol, sodium. These nutrients should be towards the 5% rule. So first is the serving size, second is the 5% and the 20% rule. Third is the ingredient list. So whatever ingredients is there on the box, on the product, it has been mentioned as a quantity wise, like the first 3 ingredients in the ingredient list it consists of the major quantity of the product. So definitely it should not be from the carbohydrates, the fats and the sugars. But most of the products these days, they don't mention sugar as such. They have so many synonyms to it, like corn syrup, cane sugar, maltodextrin, ethyl maltol, high fructose corn syrup, invert sugar. So it's all hidden there. So you need to look into it. And the next point is sugars will not be mentioned in percentage. So you need to remember all products where you have more than 8 grams of sugar per portion should be avoided. So this is a simple way of reading a nutritional fact label in a product. I hope you will try this. First is the serving size, second is the 5 and 20% rule, third is the ingredient list, and fourth is the sugar quantity. Next. Simple carbohydrates, as I told you in the previous slides, simple carbohydrates has less fiber in it, which will make you more hungry, and you don't feel full, and then thereby your post meal sugars will increase, and leading to an increased body weight, and again this is a vicious cycle. Next. Complex carbohydrates, which is it's high in fiber. You feel full, and you don't I mean you'll feel full, and the satiety value is high. Your post meal sugars can be maintained, which thereby you can reduce weight. Next. So next. Okay. What are simple carbohydrates and what are complex? So simple is the refined white products. Just to remember in easy ways, to all the white products, the white rice, the white bread, the sugars, the white pasta, these are all simple carbohydrates. And the complex carbohydrates are the multi-grain bread, the wholemeal bread, the brown bread, the brown rice, which, and in fact, even if it's the pasta, instead of choosing the white, always choose the brown, the durum wheat ones. Look for the products, look for the right products before you purchase something. Next. So now that I've just given an idea of carbohydrates, next is the proteins, which is the power food of every meal, and it's loaded with minerals. And when you choose proteins, be it a vegetarian or a non-vegetarian, you need to make sure that all your meals consist of proteins in them. If you're a non-vegetarian, or you can go for chicken, lean meat like chicken breast or the skinless one, and fish is okay, but then try to limit the shellfishes, nuts, low-fat dairy products. If you're a vegetarian, definitely beans, lentils, pulses, legumes. These are all loaded with proteins, and make sure every meal, breakfast, lunch, dinner, whatever you take, there should be a portion of protein in them. So 1/4 of your plate should consist of proteins. Egg whites are also a good source of protein. So it's very important to include in your daily diet. Yeah. Next comes the fats and oil. This is very important. Make sure you choose the right kind of fat or the oil medium for cooking, like the sunflower, safflower, rice bran, wheat bran oil. Olive oil is good, but then it can be used as a salad dressing, and do not heat them. Try to avoid and limit trans fat and saturated fat. So trans fat is mostly found hidden, in most of the products, like the fast foods, like the pizzas, the burgers, the donuts, the muffins, the pastries, the cookies. They're loaded with trans fat. In fact, even the nuggets, the French fries, and all these things. Go for good fats, as I told you, from nuts, flax seeds, pumpkin seeds, avocado, and whatever oil you use, the consumption per person should be around 3 to 4 teaspoons per day. That is it. That itself is around 15 to 20 ml. But in order to avoid or the decrease amount of oil consumption, try avoiding frying or fried fatty foods in the diet. In fact, you can go for air fryer if you really want something fried instead. Choose other healthy cooking methods. Next. Fiber. It plays a major role in your diet. It keeps your digestive system clean, and it helps in lowering your blood pressure, cholesterol, controlling your diabetes. Also, it gives you that fullness, and you will not overeat. Next, it's a continuation towards from the fiber point of view. Is next slide is the juices. You need to choose the right thing. Juice versus fruits. So remember to choose whole fruits over juice, as long as you are able to chew the fruits. Try not to choose the canned juices. In fact, even if it's freshly squeezed or blended, try not to choose them because juices are having more sugar than when compared to the fruits. Remember not to take fruits along with your meals, like you're finishing your breakfast, lunch, dinner, immediately you need a fruit. No. Whenever you're eating a fruit, make sure you eat it in between time when you're not eating anything else. Have it as a snack. Try to avoid ripened fruits and stay hydrated by drinking, normal water instead of sugary drinks. You can have buttermilk. You can have normal water. You can flavor it with any of the spices. Some people flavor it with different kinds of spices. So definitely fruit any day than juices. Next. Healthy cooking methods, which I was telling you when I was talking about fats and oils, is more, choose more healthy methods like grilling, baking, stir frying with very less oil. Make sure you can use steaming, but try to avoid the extra oily, fatty foods that is prepared at home to avoid the unnecessary calories and fat. That's adding to the calories, total calories, thereby increasing the blood sugar, the blood cholesterol also. Next. One major portion is your major thing that you have to do or practice doing is measure your ingredients. I'm sure most of y'all must be having measuring cups and measuring spoons in your house. So make sure, because even if it's not practically possible every day in your busy schedule, at least try to measure ingredients maybe whenever you're free during the weekend. You will get an idea of how much is a 1 cup, half cup, quarter cup, or simple things by which you will be able to choose your the ingredients correctly. So basically, if you're serving the cereals or the carbohydrates, make sure it's a simple technique is a fist, folded fist full of carbohydrates, open a palm size portion of the proteins. The vegetables should fill 2 open hands, and your fat should be not more than the size of the tip of a thumb. And make sure half your plate is served with vegetables. And when you serve yourself in your plate, don't fill with the carbohydrates first. Make sure you fill the vegetables more, then the carbs, then the proteins, and then dairy comes. And vegetables need not be normal salads. It can be a little bit of salads, some cooked vegetables, some steamed, sauteed, any form. Next. Rules to be followed in a restaurant. So now in UAE, it's mostly we have this weekend culture. So every week we are in a restaurant or we order food. So make sure whenever you are ordering food or planning to eat out, make sure you plan your meals. And remember, whenever you're planning your meals, try to choose a healthy cuisine. First thing, try to choose the healthy way of cooked foods like the grilled, steamed, sauteed, boiled, baked. If you're ordering something out, in the hotel or at home, make sure a big bowl of salad is ready on the table before the food reaches you, or you can order a salad, not the creamy salads, the plain salads, not with the cheesy toppings and all. And make sure you have the salad first. By the time the food comes, definitely your quantity of intake will be less. Make sure you share the orders. Like, don't order separate one meal per person. That it's gonna be, you're gonna consume it all, and if not, you're gonna refrigerate, and maybe in the next day this will be consumed. So better to order less. And when you're extremely hungry, please don't go to a restaurant starving, because most of the list of food that's mentioned in the menu card, we might feel like ordering, and we end up ordering, and then we're not able to finish it. Then we pack it home, then we finish it at home, maybe in the next meal, which is not required. So try to have planning. And when you're choosing a dessert, make sure you choose a fruit-based dessert rather than the sugary stuffs. Next. Definitely, this is a tip from me to you people. Enjoy your favorite foods, but keep them for your treats in limited portion, but not on a daily basis. Maybe once in 15 days or once in a month, or maybe once in 15 days is fine. Next. This, I think my colleague Dr. Asia has already been given a big uh, detailed explanation on smoking and alcohol, but I would like to just highlight few things. 30 to 40% of people who smokers who are at least 30 to 40%, they are likely to develop type 2 diabetes. And smokers who have already having diabetes have high risk complications like the heart, kidney, and lung diseases, and you have poor blood flow to the legs, feet, uh, causing infections, ulcers. Uh, Alcohol, again, moderate amounts is fine. It rises your blood sugar, yes, but excess intake leads to risk of hypoglycemia, which is low sugar. Hypoglycemia going below your sugar level going below 70. If it is unnoticed, it's going to be dangerous. It is also a diuretic, so you're going to be drained off. Please stay hydrated and prevent dehydration. If possible, try to avoid or limit alcohol and smoking. Next. Exercise, the second part of my presentation, which is very, very important. Exercise it's a secret weapon to help fight diabetes. The benefits are, it improves the blood sugar, pressure, cholesterol. Also, it helps you reduce your excess over weight, improve circulation, and by proper diet and exercise, you can definitely control or reduce the amount of the dosage of the medications that you've been taking. At least the insulin dose can be a little bit reduced. The oral tablets can be, the numbers or the doses can definitely be reduced if you're incorporating proper diet and exercise. And it prevents weight gain. It improves strength and flexibility, improves brain function. And for people who are diabetic for many, many years, they tend to lose their muscles and everything. So it's always better to do a little bit of mixed exercises to retain them. Next. Yes, so what should be your exercise plan? Definitely you need to consult your treating physician before starting any activity, because they are the persons who know you in and out, what your type of diabetes is and what kind of medications you are, what are the complications you've been experiencing. Your exercise plan, if you are a person who is not doing any kind of exercises, definitely start doing with a small timing. Like, don't do 30-40 minutes of strenuous exercise once you're starting new. Start with 10 minutes of walk, little bit of stretching. Definitely include different mix and match exercises. So gradually add up 5 minutes per week and reach a target of 30-45 minutes. Minimum of 150 minutes per week is recommended. But what kinds of exercise to be done? You can go for isotonic or isometric. I'll show you examples of that. So regular exercise and healthy diet will improve diabetes management and the quality of life. Next. So isotonic, jogging, walking, cycling, swimming. Isometric is a little bit of weights, some yoga, some push-ups, some planks. So try mixing them. Now, most of the questions that I get from my patients will be shown next in myths and facts. Next. So some of the myths and facts that I'll be discussing now is the first one. Next. Yes, one of the doubt that everyone has is people with diabetes or pre-diabetes should follow a diabetic diet. No, there is no such thing as a diabetic diet. People on diabetes need not feel like they are being put on a strict diabetic diet. No, it's only healthy, balanced diet with moderation as the key important thing in that. Next. So there's another myth which is running around is I got diabetes because I ate too many sweets. No, sweets is not just the factor that is causing diabetes. So it is also previous. Yeah. So sweets has increased. It's high in calories. Sweets definitely it will lead to high blood sugar or weight gain. But then the total calories matters, not just from the sweets. It also comes from the other kinds of food, maybe the fried foods which is not sweet. It all adds up. So it's not just the sweets that causing diabetes. We have patients who don't like sweets also having diabetes. So this is not the only reason behind diabetes. Next. I boil and drain my rice, so the starch is drained away, so I can eat more rice without it affecting my blood sugar. So this is another myth. By boiling rice again with twice or thrice and draining the water, you are losing all the vitamins, especially the water-soluble vitamins, the B vitamins, which you require. Then soak for a long time or boiling for a long time or draining the water. It doesn't make any difference. Quantity matters, so decrease the portion sizes. This is not recommended. Next. Honey, jaggery, brown sugar, it's all the same. I mean, people think these are all better than the simple sugar that has been used. No, these are all the same. There's no difference between these things. They're all sugars. 1 tablespoon of honey or jaggery, it's all is equal to 1 tablespoon of simple sugar. So they're all carbohydrates which can raise your blood sugar in a similar way. Next. My blood sugar is high because I eat a lot of spicy foods. Yes, definitely spicy, oily foods. Spices is not, it doesn't affect your sugar levels, but then spicy, oily foods definitely can affect. So limit the amount of salt and sugar and fat in the cooking, but spices like turmeric and, we have so many n number of spices around us which can be used to flavor the food that you feel, which is you feel that food is so boring or it's not tasty. Definitely spices will enhance your the flavor of the food. Instead of adding extra sugar, salt and fat, spices is a good choice. Next. Healthy foods are usually tasteless and bland, which people think, but no. Definitely, as I explained in the previous slide, spices enhances the flavor. You can adopt healthy cooking methods, as I have mentioned earlier also, like steaming, grilling, baking. Next. I'm active at work and home, so I don't need any other scheduled exercise. No. So whenever, yes, active at work and active at home is good, but it cannot be considered as an exercise pattern. You need to fix yourself sometime, maybe inside your home or in the corridor or whenever you find outside. Try to plan and schedule an exercise pattern because it's very beneficial. It improves the body sensitivity to insulin and helps control blood glucose levels. Try this out, you're going to have benefit. Next. Bitter melon, bottle gourd, lady's finger water, these things, cinnamon. These are all myths or home remedies that people do in order to avoid the high diabetes, high sugar levels or the pre-diabetes stage. People think this is gonna bring a huge difference. No, yes, it has marginal effects, marginal positive effects, but there's no conclusive scientific evidence for all these tips. It can be included as in a healthy diet in a, in fact, a bitter melon or lady's finger and all these bitter gourd. It can be normally cooked and included in your daily diet rather than drinking the water or the juices. Next. Yeah, and can you go to previous slide, please? Yeah, another important thing which I missed out here is you should not rely on such myths and keep your even if your sugars are going up, you should not be relying on such tips and avoiding consulting a doctor, which is not recommended. Always make sure you consult your doctor. Okay, you can do these things, but then definitely take the opinion of your doctor. Next. Okay, so I'd like to conclude my presentation on diabetes. Like if you have pre-diabetes or if you are type 2 diabetes, definitely if you are pre-diabetic, definitely it can be prevented with proper healthy diet and exercise rather than leading to a type 2 diabetes, or maybe you can delay the onset of type 2 diabetes. It helps to lower your risk and lead a healthy lifestyle. So enjoy your healthy food intake, be physically active, maintain a healthy weight, talk to your healthcare provider about being screened for pre-diabetes. And this can always remember to go for a healthy diet rather than going for the currently famous Google diets that we are, that's happening around. It's always better to go for a healthy, balanced diet which is sustainable, which can be carried forward for a longer time. Next. So my tip to you people is good eating habits will only cost you good health. Thank you so much for listening to me. You can put in your queries in the questionnaire and I'll answer to you. Thank you so much.